Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take the next few minutes to talk with you about 4 urologic emergencies. Most urologic conditions do not require emergency treatment. However, there are 4 that should be considered an emergency and require a trip to the emergency room. In the next few moments, I will discuss with you the 4 urologic emergencies that do require immediate attention. First is acute urinary retention, or the complete inability to urinate. This usually is caused by a blockage of the urinary tract that results in extreme pain and does need immediate attention to relieve the obstruction. It also may be caused by a loss of the nerve signals from the brain and spinal cord to the bladder. Conditions that cause acute urinary retention are benign enlargement of the prostate gland, prostate cancer, prostate infections, blood clots, nerve damage, side effects of medication, and also can occur after surgery on the prostate gland, the bladder, or the rectum. The treatment for acute urinary retention is the insertion of a catheter or a tube into the bladder to relieve the obstruction, and then the cause is identified, and then appropriate treatment is instituted. The second urologic emergency is testicular torsion. This is a condition when the testicle twists and turns and causes a blockage of the blood supply to the testicle. This results in severe pain in the scrotum, and often swelling accompanies the severe pain. This is an emergency and needs to have immediate surgery to untwist the testicle and to restore the blood supply, or there is a risk of losing the testicle. This usually occurs in young boys, but it can occur in men at any age. The treatment is an immediate surgical procedure to untwist the testicle and to tie it down into position so it cannot twist again. The third urologic emergency is called Priapism. This is a prolonged, painful erection lasting more than 4 hours. The condition is caused by a failure of the blood to leave the penis after the onset of an erection. It needs to be treated immediately, as it can lead to scarring within the penis and subsequent erectile dysfunction. It is usually caused by injection of medications to create an erection, or it can be caused by blood diseases such as leukemia or sickle cell anemia. The treatment is immediate evacuation of the blood from the penis, or to perform a shunt to reroute the blood from the penis to the general circulation. The fourth urologic emergency is called Paraphimosis. This occurs when uncircumcised men have their foreskin trapped behind the head of the penis. It can be caused by infection, it can be caused by trauma, or it can be caused by diabetes. It occurs in usually younger boys and adolescents, but it also can occur in older men. The treatment is a trip to the emergency room to see a physician to reduce the swelling of the head of the penis and to return the foreskin to its normal location. Often men will have to have a circumcision following the relief of paraphimosis in order to prevent the same situation from happening again. In summary, there are not very many urologic emergencies. There are a few that do require an immediate trip to the emergency room, and these are acute urinary retention, torsion of the testicle, paraphimosis, and priapism. If you have any of these 4 conditions, please go immediately to the emergency room. Your penis and your testicles will be so glad that you did. You may have some additional questions regarding these 4 conditions, and you are welcome to give me a call at 504-891-8454 or go to my website, www.neilbaum.com. Thank you.